There is a trend at the moment, or has been for a while, of having fillers injected into the bum, and that's to create that kind of bum lift, or I'm sure the Kardashians and other celebrities have sort of inadvertently promoted. Injecting fillers into muscular and highly vascularized areas, that's like areas that have a lot of blood supply, is really risky. Happy 2024. I hope everyone has had a great start to the new year. I delayed a little bit putting out a newsletter, just took a little bit of a break. Still have been busy, very busy doing GP and some private medicine and obviously NHS medicine as well, and also in clinic. So hi, I'm Dr. Sunny Dhesi. I'm the owner of Vysana, a clinic in Rutland, in Oakham, Rutland, where we practice private medicine, private GP, mindfulness, menopause matters, women's health, and aesthetic treatments as well. So thank you for joining me for this 2024 newsletter. If you haven't already subscribed to our Vysana YouTube channel, then please do so, and always hit the bell for notifications. And I look forward to sharing with you some great information for the new year. So what am I going to share with you today? So I'm going to talk to you a little bit about Safe Face, a lot of promotional and educational material put out by Safe Face, which is a government accredited advocate for safety in aesthetics. Share a little bit of information from them. And I also wanted to share some skin tips, a few ways to help manage dry and dehydrated skin. So if you're suffering with dry, itchy, flaky skin, or tight, shiny skin, feels a little bit sore, that's dehydration. I'm going to share some of those hints and tips with you. And then lastly, just how we're doing in clinic and potentially some treatments that we are focusing on for this month. Thank you for joining me. We are a Safe Face accredited clinic, which means we've gone through Safe Face's rigorous process of checking what we do in clinic, elements of patient safety, patient communication, the treatments that we offer as well, and obviously that I'm qualified, see some certificates there behind me, and that I am a medical practitioner. So Safe Face is a government accredited patient advocate group, essentially. And one of the things that they are really highlighting is how unregulated the aesthetics industry is in the UK. Anyone and everyone is unfortunately able to do aesthetic treatments, whether it's wrinkle relaxing injections with botulinum toxin type A, or Botox as we know it, or dermal fillers. Now, all of these treatments carry a degree of risk, and whenever patients come into clinic, whenever you come into clinic, I will always discuss those with you, the risks and the benefits. The benefits we can wax lyrical about, with, for example, dermal fillers. They're great at rejuvenating the skin, improving and lifting, increasing elasticity. However, there are side effects as well. So redness, irritation, and bruising can happen when we're injecting, as well as the more serious ones like vascular occlusions. That's what Safe Face were talking about, that there is a trend at the moment, or has been for a while, of having fillers injected into the bum, and that's to create that kind of bum lift, or I'm sure the Kardashians and other celebrities have sort of inadvertently promoted. Injecting fillers into muscular and highly vascularized areas, that's like areas that have a lot of blood supply, is really risky. Now, we have ultrasound in clinic, so a very small device. Many of you are probably familiar with this. This is a quite a powerful ultrasound. It's mobile. We have the image comes up on our iPad or our phone when we're doing treatments, getting tongue-tied there. And by using the ultrasound on the skin, we can actually look underneath and see where big blood vessels are, arteries, because we want to avoid those. We don't want to inject anywhere near and around arteries, because if filler gets into them, it blocks it, and it can block the blood supply, and then that can cause what we call tissue necrosis, which is death of tissue. And you've probably seen possibly flashes of images are coming up on your feed now and again where, filler tissue necrosis, or I had fillers and it caused this to my skin. So part of the campaign from Safe Face, which we fully support, is that the government should be regulating these procedures, and you should definitely not be having dermal fillers injected into your bottom. It's definitely not there. There are treatments that can be used, for example, radio frequency or things like that. However, dermal fillers can be injected in various places in the face. We use ultrasound in clinic to make sure that where we're injecting, we know where the filler is going. And if there were any problems, then we'll be able to image that area and potentially reverse the process. So that was a little bit of news on the industry, Safe Face, and also it kind of ties in with having worries about having dermal fillers. So you really want to have a consultation before you have any procedure, and that's what we offer here at Vysana. So skin tips for winter skin. It's still winter, the weather keeps fluctuating. 1 minute it's warm, 1 minute it's freezing cold, and that plays havoc with our skin. I'm sure you know about this. It's, for example, you go outside, you've only been outside for a little bit of time, and suddenly you get this tight feeling in your skin feels sore, you can get redness across here, and then you go into a warm environment and you can feel the blood rushing to your skin, it goes red, or you're getting dry, itchy, flaking skin as you're coming in from the cold. So what can be done? So firstly, a lot of patients I found are using exfoliating products. Now, even vitamin C, so for example here I've got a 10%, which I've spilt in the bottle, apologies, a 10% Abajo vitamin C. This is a great product. However, vitamin C has an exfoliative property to it as well, and some patients are using it in the evening. I would always recommend using vitamin C in the morning. I think it's better absorbed. You can layer a product over it, and that antioxidant effect is better throughout the day when there's more environmental pressures. At nighttime, I have found that especially with perimenopausal and menopausal skin, it can lead to breakouts. So you'll be applying vitamin C between 10 and 20%, you wake up in the morning and you've got these breakouts and you're not sure where they're coming from. Is it hormonal? Is it something that I've eaten? Or is it the vitamin C? Now, vitamin C doesn't cause that for everyone, but what I will say is after cleansing, and I would generally at this time of year use a cream-based or balm cleanser, apply some serum in the morning, and then apply moisturizer over the top. So another tip that I have given before, so 2 products here. So Vaseline, and we've got Made of More, our rescue balm. So these are both occlusive. So Vaseline is paraffin and it is very occlusive. We sometimes recommend this for after treatment. For example, we've done cryotherapy, removing skin tags or lesions on the face. We advise patients to put that over on there. Now, Vaseline is kind of an occlusive moisturizer. It basically prevents water loss. But a lot of people don't like using Vaseline because it doesn't really blend into the skin, and it's paraffin. Nothing wrong with that. In small amounts, it's fine. It's a very useful product. However, I would recommend for most patients using Rescue Balm. It's thick and it has an occlusive property, but it's the hemp seed complex in here and the CBG that really helps to support an anti-inflammatory environment, and it also helps to retain moisture. A little tip that if you're going running in the mornings, or you're exercising in the mornings, or you're even walking the dogs, then if you haven't even washed your face, you don't need to, you don't want to, then placing a small amount of this over the areas where you might experience redness, soreness, dry, itchy skin. A lot of people get redness around here, around the nasolabial area. Putting a nice more occlusive balm moisturizing agent like this helps to prevent that environmental damage, and it helps to support your water barrier function, your skin barrier function, I should say, and that helps to prevent water loss, which then in turn you'll find that when you come back in, your skin won't be red and inflamed. You can, in addition, when you're putting that on, you can put a little bit of moisturizer on as well. Now, this is a bit more occlusive, so it's preventing water loss, and then a moisturizer obviously adds moisture on. It might contain hyaluronic acid, and that will then act as a humectant. It draws water in from different areas of your skin to help nourish and support those areas. A lot of non-medical terms being used, so I hope that if you are medical and watching this, that you don't pick me up on this, but this is to sort of explain it in simpler terms, that what we are doing at this time of the year is not too much exfoliation. Vitamin C is fine. I would recommend not using it in the evening because of the risk of that exfoliative action at nighttime and potentially causing a few breakouts. I would use it in the morning. You can layer it with products like this. Our Made of More product is actually available on our website from our shop if you do want to purchase it. And then if you do want a consultation or virtual consultation, please do book in and we can talk about moisturizers as well. So in summary, layering up, use something like a serum, then maybe something more occlusive, then moisturizer over the top, and if it is sunny, then always do use a SPF as well. So I hope you have found that useful. Dull and inelastic skin. My skin is dull. Doesn't have that glow to it. I feel like lines and wrinkles, fine lines and wrinkles are starting to appear. What should I do? Well, one of the great treatments that we have in clinic, apart from skincare, is skin boosters, especially Profilo. And I have worked very hard with our suppliers, and I'm happy to say that we have reduced the price of our Profilo. So if you are interested in tackling dull, inelastic, fine lines and wrinkles, obviously Profilo is not suitable for everyone, but it is a great maintenance product, especially in between fillers. Or if you've never had fillers before, this is a great product to understand how hyaluronic acid in an injectable form can really help inelastic skin, dull skin, a little bit of sagging. Over time, repeated treatments with Profilo, which is why I've reduced the price, really does help to maintain that plumpness in your skin. So if you are interested, please do contact me in clinic, information@vysana.com, or you can go on the website and book in for a consultation. If you've had Profiler before, then you can book straight in with us. So I hope you've enjoyed this newsletter. It's our first one of 2024. I'm glad to be back. Feedbacks, comments are really always useful. Really appreciate it. If you haven't already subscribed to our YouTube channel, Vysana Life, please do so. And I look forward to sharing more hints and tips and skincare needs, meeting you in clinic. I look forward to seeing you soon. Thanks very much for watching. I'm Dr. Sunny Dhesi.